The Senate Healthcare Committee that I chair is doing an interim study of the issue of clinical trials. What that simply means is that if somebody is an end-stage cancer patient or heart patient or diabetes patient or COPD, conventional treatment may not have worked, but there are FDA-approved clinical trials, either medicines or procedures that might work. We have wonderful teaching hospitals and medical schools in our state that use clinical trials to advance medicine, to advance treatment, but also try to help people for whom the other conventional methods may not have worked. Now, the problem is that under our current insurance policies in the state of Florida, millions of Floridians have health insurance policies that say if you become a participant in a clinical trial, if your doctor says, hey, you could benefit from this, then you would lose your regular insurance coverage for ordinary care and services associated with your disease, and even if you break a leg coming home from the hospital. So what I'm doing is I've met with industry representatives, with insurance representatives, with the teaching hospitals, the medical schools, and said, look, this is wrong. This is a moral issue. You don't want to say to somebody the insurance coverage that you have is suddenly and summarily gone just because you've agreed to be part of a clinical trial. And so we're asking our players in Florida to do what we've done in Georgia and in other states, and that's create a voluntary compact to take care of this problem in a way that's agreeable to the insurance companies, that's fair to our patients and their families. Failing that, I will introduce legislation in the Senate to require not additional coverage, not mandated coverage, not expanded coverage, but gosh, if you're sick and you've got insurance coverage and you go into a clinical trial, I just don't want you to lose the coverage that you have. And that either will be the subject of a voluntary compact, which is what we all want, and failing that, the subject of a bill.